Hello and welcome. My name is Eric Sloss. I'm the Executive Director for Communications at the University of Pittsburgh at Johnstown. Welcome to COVID Questions. The series is in partnership with In This Together Cambria, the Tribune-Democrat, and Pitt-Johnstown. The goals of the seminar are simple. We want to provide sound scientific advice from trusted community sources, make the information relatable, and put a human perspective on the pandemic. We want to dispel fears and misinformation concerning the COVID-19 vaccination. And most importantly, we want to answer questions from you, our community and beyond. Mr. Chip Minemyer, editor of the Tribune-Democrat, will moderate this virtual town hall with two members of the Pitt-Johnstown faculty with expertise in this area. Dr. Jill Henning, an associate professor of biology, and Dr. Matthew Tracey, an assistant professor of chemistry. I want to let everybody know who's joining this webinar that at the bottom of your screen, you can tap the Q&A section of the webinar and ask questions. Throughout this webinar, we will be collating and collecting questions, which we'll be sending to Chip to answer on a regular basis throughout this evening. And also, please take the survey at the end of this webinar. I would now like to introduce Chip Minemyer, editor of the Tribune-Democrat, to start this discussion. Chip.
Eric, thank you so much. Got a lot of great questions already lined up, and it looks like we're starting to get some already from the audience. So I expect this to be a fantastic and informative session for all of you folks who are tuned in. Thanks for joining us. First question is, we've heard many things about messenger RNA or mRNA vaccines. Can you describe for folks who are tuned in this evening how mRNA vaccines work? And we're going to start with Matt.
All right. So to really understand how an mRNA vaccine works, we sort of have to take a step back and discuss something called the central dogma of molecular biology, which really just sounds like this horrifyingly terrifying term. Some of you out there may be having flashbacks to biology classes, but really all it is a fancy way of saying that DNA becomes RNA, makes proteins. And by boiling it down to that two-step process, we can look at how an mRNA vaccine works in the context of how our own bodies use our DNA to make RNA, to make proteins. So whenever our body needs to make a protein, the DNA is in the command center nucleus of our cells. And from that command center, it allows to template for RNA. So another way to think of this is think of DNA as the word hello and mRNA as translating that to the word hola. It's the same thing, just a slightly different language. The mRNA then travels to sort of the factory of our cells known as these things called ribosomes. And it serves as a blueprint for the ribosomes to help us make a protein. From there, the protein, going by our hello, hola dichotomy, is sort of like waving to somebody. It's more universal. It's not language specific. And in doing that, our body can then take those proteins and do whatever it needs to do with that. With an mRNA vaccine, instead of giving us a full-blown weakened form of a virus, we're just injecting that mRNA into the body, bypassing the nucleus completely, so it never goes near the command center and everything. It just goes right to those ribosomes and templates for a protein, in this case known as the spike protein for COVID. So by giving us a blueprint for the protein itself, we're giving our body a way to recognize what's going to happen. And it's kind of curious because with these mRNA vaccines, we've all heard it's been developed in conjunction with Operation Warp Speed, but really mRNA vaccines are over a decade old. So Operation Warp Speed is kind of a misnomer. It's really more Operation Start on Second Base and Run Home. Because with this new mRNA vaccine, it's just following along with things that have already been developed for things like prostate cancer, glioblastomas, and other cancers. We inject the blueprint for the protein, and that allows us to then develop an immune response. And for that part of it, I'm going to pass it off to Jill here to sort of discuss the virus and the immune response there.
Thanks, Matt. Sure, after the blueprint is given to the cells, they make the protein, and then that protein is going to be displayed or presented on the surface of the cell. And then our bodies will fight it off like it were any other foreign invader or foreign substance. And so we have the entire immune response without actually being infected with a pathogen. So that's a really great way of handling it. And it's the way that vaccines will be conducted moving forward, in my opinion. So I think it's wonderful, and we see about 50% coverage from the first dose and about 95 to 100% coverage from that booster dose, because of the way that our immune systems need to handle it.
Okay, thank you, guys. Again, we'll reiterate that you can ask questions from the audience either on Facebook Live or through the Q&A function here at the forum. And we remind you that there'll be a survey. I hope everybody will take at the end. And moving on to the next question. The vaccines now being distributed were fast-tracked to get them out to healthcare workers and first responders quickly during this pandemic. Because we don't have as much information from research as we typically might, is there potential for unforeseen side effects down the road? And I believe, again, Matt's going to take the first crack at this question.
Yes. So with respect to long-term side effects and expectations there, I just want to reiterate that mRNA vaccines are over a decade old. This is not a new technology. It's been widely studied in the past, which again, we're starting on second base and bunting it home. And one thing to note that although this vaccine was fast-tracked, it was a very unique case in that large amounts of funding were allocated, as well as the size of the clinical trials involved were remarkably larger than normal. On average, a clinical trial might have 400 to 500 individuals across the entire 4 major stages to start. We were looking at over 30,000 individuals being inoculated to give a very wide umbrella of what could happen in various backgrounds and exposures. And regarding the possibility of any long-term effects, one thing with these clinical trials is for any medication developed, really, the doses given in animal studies are 10 to 100 times higher than administered that would ever be given to a person. So we immediately test in animals, see are there any possibility for organ damage? And in this case, there was none observed because the mRNA injected is simply a blueprint to make a protein. Once that protein is synthesized, your body breaks down the mRNA. It's wildly unstable on its own, hence the cryogenic temperatures for the vaccines. And as a result, because you're only making that singular protein, there's really not an expected long-term side effect.
Okay, thank you. I want to go to a quick question from the chat. It's a pretty good one. This one comes actually from Facebook. When and where, this is not scientific, this is more logistical. When and where will vaccines be available to teachers in the area? Do we know that yet?
I have some information on that. Recently, the Pennsylvania Department of Health released a new COVID vaccination dashboard and plan. We're right now still in this state, we're still in 1A. So we're still in phase 1A. Teachers and other professionals who are considered to be essential workers, and we all know that our teachers are very essential, are going to be in 1B. And as soon as the 1A series is finished, Conemaugh Hospital will be coordinating with each individual school district and other areas in the county and in our area that are going to be a part of the 1B group, and they will organize it with your employer. What will happen is you will schedule your vaccination. Say you schedule your vaccination for Saturday at 3:00. And then 21 days later, if you're getting the Pfizer vaccine, it'll be at 3:00. And 28 days later, if you're getting the Moderna vaccine, it'll be at 3:00. So those are going to be coming shortly. So if you are a teacher, your superintendent and your administration will be reaching out to you shortly to get that information to you. We are close to reaching the 1B level. We're just not there yet.
Thank you. Here's a quick Q&A question as a follow-up to our first couple of conversations. And this is, do we need to worry about long-term side effects? And let's just kind of wade into that a little bit.
So I'll take that one, Chip. With respect, the fear of the long-term side effects, a lot of it boils down to with other vaccines in the past, people have been injected with either a weakened form of the virus, or a lot of people haven't seen that this technology isn't really new. When employed in the past, there haven't been any cases of long-term side effects. The biggest issue with developing these vaccines has just been clinical trial data to show that they have the efficacy they needed. So scientifically, there hasn't been any evidence of long-term side effects in the previously developed mRNA vaccines for, like I said, various cancers, glioblastomas, prostate cancer. And I don't expect there to be any expected long-term side effects with this one.
And to add to that, to add to what Dr. Tracey was saying, that protein, the spike protein, if we were going to see allergies to any kind of spike protein, we would have already seen it in individuals who were infected. And they're not experiencing allergic reactions when they're getting infected with the pathogen, with the virus itself. And since we're only using that same protein that's already on the virus, we don't expect to see any kind of allergic reactions following that. There's a little bit of a chemistry called a nucleophilic attack that happens whenever we have allergic reactions that occur. And that would have already been seen if it were happening to the virus in an individual. So we can surmise from that experience that there aren't going to be very many allergic reactions to this one.
Thank you. Following up on your earlier answer, Jill, someone asked, how do I know if I'm an essential worker?
That is a great question, and I should have addressed that to start with. So thank you for asking. The state health department, and I know that some of you are watching from other states, so you can go to your own state health department website, or you can check on the CDC's website, and they have a list. In Pennsylvania, they have a list. I'm going to ask the people that are managing the chat to put the COVID dashboard list up on. You can see which phase that you're in. There's a nice infographic that the Pennsylvania Health Department has. But essentially, if you're not in healthcare, in some form of healthcare, you're not in 1A, or if you're not in a nursing home. If you're in 1B, we're talking about educators, individuals who are essential workers, and a few other and individuals under over 75 years of age who have not gotten the vaccine otherwise. And then we move into 1C, where we're talking about, public servants, lawyers, individuals who are working with like the various county departments, maybe garbage collection, or, other types of things. So civil servants, postal workers, and then everyone else in phase 2. So that's a brief rundown, but we'll find that for you on the Pennsylvania's website and post it somewhere. Okay.
Excellent, thank you. Here are some questions we frequently see concerning vaccines and how we should respond to them. Can you spread the virus once you get the vaccine? A lot of people want to know that. Do vaccinated people still need to wear masks, maintain social distancing, take other precautions? And when do you anticipate that we will not need to wear masks anymore? Are we looking at a date down the road?
Well, science isn't certain yet when we will be, if you're able to spread the virus or not after you've been vaccinated. So the way I like to explain this one is with something that if you have been around infants or newborns, sometimes all the time, they tell you to make sure that you've had your DTaP, your tetanus, diphtheria, and pertussis shot, sometimes known as the tetanus shot. And that's because pertussis, the agent that causes whooping cough, has the ability you can be a carrier for that. You yourself are asymptomatic, but can transmit that infection to someone else. And so we don't know yet. More studies need to be done if SARS-CoV-2, the virus that causes COVID-19, is going to be able to have an asymptomatic carrier status in an individual who is vaccinated or not. So we have to make sure that we are still following our social distancing, wearing our masks. And I sincerely hope that if we are capable of reaching a level of vaccination approaching 80% in the population, we will be able to stop wearing masks. And I hope that happens this summer if we can get people to get a shot in the arm.
Excellent. Here's one I think will go to Matt. Both the Pfizer and Moderna COVID-19 vaccines require 2 doses. We've all heard that. Why is that? And how important is that second shot?
So with the vaccines themselves, as Jill pointed out, your first instance of getting the shot, the first dose, will confer about 50% immunity to the body, because the mRNA template that you're injecting isn't going to be the most stable thing. It's going to decompose naturally. and your body doesn't always have the best memory. And I myself sometimes forget very basic things. And if you're getting an injection, your body might not remember what the blueprint was by the time it's degraded. So getting that second shot is sort of reminding your body and really making sure you've developed a strong enough immune response so that if you are ever exposed to COVID, you have the ability to then have the antibodies fight it immediately. So it's sort of just like a booster shot. It's conferring a more robust immune response overall.
From the audience, here's a kind of a follow-up question. How long after that second booster should someone who's been inoculated be considered to be safe?
Also, for that case, they say that for the booster themselves, it should take about 10 to 14 days to fully reach the peak immune response. Although, again, as Joe pointed out, we should still be wearing masks, socially distancing, following proper hand washing. The second dose will come into effect roughly 10 to 14 days and reach its peak level of development around that time. Though, again, we should still be following all of the CDC recommended guidelines regarding masks, social distancing, et cetera. So I consider safe to be sort of a loaded term in that respect. It's more so you've developed the best response you're going to have at that point.
Great answer. Thank you. This one comes from the audience also. I'm going to get the pneumonia vaccine this week. It was announced today that as they changed the vaccine protocol process to those 65 years of age and older, should I still get the pneumonia vaccine? And how long between pneumonia vaccine and COVID vaccine should I wait?
That is a fantastic question, and one that I am certain several other people are feeling or worried about. Right now, what is standard for the COVID-19 vaccine is that if you're getting another vaccine, you wait 2 weeks. Give your body that time that Matt was talking about to boost that, to make that immune response to the previous vaccination. And then you wait 2 weeks till you get the next one. So if you're going to get the pneumonia vaccine, wait 2 weeks or 14 days until you get until you start your COVID series.
All right. Here's another one from the audience. Is Oxford vaccine, is it going to be superior to Moderna and Pfizer, since Oxford is used normally for the flu vaccine? Interesting question.
It's a very interesting question. And so far, it seems that given the benefit from the mRNA vaccines, I would predict they're going to be similar to equally effective in conferring an immunity, because they're both allowing your body to safely develop that immune response that Jill talked about. With the mRNA vaccine, you're just getting the blueprint and developing the spike protein on your own. With the modified flu vaccine for the Oxford-based vaccine, you're just getting a similar vector with roughly the same output, just a different way to get it in the body.
We had an advanced question ready that we kind of touched on with the teachers and where they fall in the line. Do we have any other information we want to provide? I think we've got everything up there. Are we pretty good with that question about when each and every one of us might feel like we're going to be in line for the vaccine?
I did make available the vaccination the website, associated with who falls into which category, at least for Pennsylvania. I see that it has been posted into the chat. So if you're on the Zoom, it's posted into the chat. I'm unable to monitor Facebook at the moment, but if it's not there now, we will make sure that it's up after the event.
There you go. Let's talk a bit about what scientists, and we've got two great scientists on the panel today, what scientists refer to as herd immunity. How many people have to get the vaccine in our area before we start seeing a reduction in cases and can go back to some version of normal life based on herd immunity?
Well, that's a good question. Herd immunity is a term that we use in public health and in epidemiology and in infectious diseases, to where the penetration, that's the scientific term, the ability of the pathogen to for people in a population to be protected from that pathogen. It means that it can't get into that community. So we have more people who were either infected naturally and developed an immune response, which we refer to as natural active immunity, or we have people who were vaccinated and developed an immune response. We call that artificial active immunity, artificial because it came from a medical procedure. If we can use either of those two ways to get individuals to be immune or have an immune response to SARS-CoV-2, the virus that causes COVID-19, then we have reached the threshold of herd immunity. We're looking at about 80% of the population in any given area to have reached that level of immunity, either by natural infection or by vaccination. In this case, we're hoping for vaccination due to the severe risks that COVID-19 can pose to individuals. And so if we can reach that level of penetration with the immune response at 80% into a particular population. Now, there are going to be some individuals in a population who can't get the vaccine for one reason or another. Although there are very few in this case, even individuals with autoimmune disorders are being recommended to get vaccinated for COVID-19 because it's just mRNA. So it's not a live virus. It's not an inactivated virus. It's not a heat-killed virus. It's not none of those things. So it's not going to create even a problem for even individuals with autoimmune disorders. So we're hoping that we can reach that level, but it does take community involvement and individuals being willing to get a shot in the arm. And so we have to get to 80%. I am hoping that by being here tonight, you are more informed and willing to choose vaccination, and that you'll go out and tell your friends and family to do the same thing. And we can reach 80% and be back to what we will call our new normal by summer.
Great answer. Thanks, Jill. You touched on autoimmune diseases. We had a question on the chat about lupus, rheumatoid arthritis, things like that. If you have anything more to add to that, that's great. Somebody also asked on the Q&A, if you have medical allergies, you need to worry about having a reaction to the vaccine. So maybe we can tackle both of those.
Sure. So one of the biggest concerns with the allergies is that somebody may have an unforeseen allergy, but given the number of people involved in the clinical trial, as well as everything we've seen so far, the incidence of an allergic response has been very, very low. The biggest side effects related to any sort of an allergic response would be standard to getting like a tetanus shot where your arm may be sore. You may see swelling of the lymph nodes in that area. But overall, there's not a big expectation for an allergic reaction, though you should also consult with your physician if that is a big concern of yours. And regarding autoimmune disorders, that's been a question that a lot of people have been bringing up both here and in just casually talking to friends and family. And the best answer that I can give is you should consult your physician, though currently there is no advisory or contraindication against getting the vaccine if you have an autoimmune disorder, because you are only receiving that mRNA to template for the spike protein. But again, if you'd like to be completely sure, don't be afraid to contact your physician just to double check with them.
Kind of staying with that theme, we'll take another question off the chat. Are there any recommendations as to whether people with MS should get vaccinated or not? This person has heard that the vaccine can affect T cells, potentially cause a relapse in MS. Thank you. Also, another question about autoimmune disease. Obviously, we've got a common theme going here. So I'll throw that back out to MS.
So multiple sclerosis deals in a different kind of way with the immune response. It has to deal with what happens inside of the brain with a particular kind of cell and the way that the immune system attacks that cell. It is a whole different ballgame than other kinds of autoimmune disorders. With multiple sclerosis, briefly, what happens is our brain is what we refer to as an immune privileged site. We don't have a whole lot of cells going on in there. And when we do have cells go in there because of an infection like an encephalitis or a meningitis, what happens is we create inflammation. Just like any other kind of inflammation that can cause swelling. We don't want swelling inside your cranial cavity. So with multiple sclerosis, that is something that you will definitely need to check with your physician for, because it does. This vaccine will induce T cells to be activated. That is the goal of the vaccine. And so when you are dealing with a vaccination associated with COVID-19 or any vaccine in that matter, you always want to make sure that you check with your physician first. If you start to experience those ocular issues that are occurring with multiple sclerosis replaying, you should definitely speak to your physician beforehand. Multiple sclerosis is one of the populations that we may need to protect with that herd immunity that we're talking about. but you should definitely discuss that with your rheumatologist.
Matt, you're nodding your head. Anything you wanted to add?
I was just agreeing with what Jill was saying there. At the end of the day, the biggest answer to those would be consult with a physician. There is no silver bullet answer, unfortunately.
Very good. Here's another common question. Can an individual who has been vaccinated then give COVID-19 to someone else, say a spouse? Should couples plan to get vaccinated at the same time if possible?
So I'll take that one. With the biggest thing to take away from the current vaccinations is that they're not giving you a live virus or the possibility to develop COVID-19 from them directly. As we've said a few times, you're getting just that blueprint mRNA to make an inactive spike protein, which allows you to develop that immune response. So you will not be infectious with the COVID-19 virus following inoculation. So it is not possible from the vaccination to give it to a spouse, though it is possible that if, as Jill mentioned, you could become an asymptomatic carrier following exposure there. It is necessary to, again, follow those protocols, but you do not need to be inoculated at the same time as your friends and family. Currently, we're working on getting deployment as much as we can. And I know it is going to be very difficult to think that you might be inoculated where somebody else in your household might not be. It is important to try to follow as much as you can with the mask wearing, hand washing, social distancing in public to minimize the risk of becoming an asymptomatic carrier, though the vaccine itself will not allow you to infect somebody directly from that.
Thank you. Here's another Facebook question. Is there any scientific data that would support a waiting period after getting COVID before you should get the COVID vaccine? Is there a correlation?
No. What we do see is that they're asking you if you have naturally acquired SARS-CoV-2 and developed that natural active immune response, that you wait about 3 months to get the vaccine, just so that individuals in your particular group who have not mounted an immune response to COVID can get vaccinated. But that's not something that you have to do. If you are in your group and your group is capable of getting the vaccination at any given time, you can. What is stated is that if you are actively symptomatic with COVID-19, you must wait until your symptoms resolve to get the vaccine. But that's not any different than any other vaccine that you would get ever. You don't want to be having an immune response naturally to something and then go get an artificial immune response to something else. There's no reason to overload the body in that case. So you are to wait, if you are infected, actively symptomatic, to get the vaccine until your symptoms have resolved. But if you were previously infected, there's no issue with you getting the vaccine again. It's kind of like the shingles shot after you had chicken pox. I had chicken pox. I will get the shingles shot in 9 years. So you have that ability. It's the same kind of process there.
That would also seem to answer this question from our Q&A about a nurse who was told she had tested positive and needed to wait 90 days for a vaccine. You said as soon as your symptoms are over, you can get vaccinated. Is that right?
Yes. The reason that they asked the nurse to wait 90 days, it may have been because they are asking individuals to go to the back of the line for their group if they did have a natural active immune response, meaning that they were infected with COVID and mounted an immune response to that. They're asking them to go to the back of the line simply so that they can make sure that everyone who is in that group can get vaccinated and have some kind of protection. And individuals who were exposed and then resulted in an infection do have immunity to COVID-19.
Excellent. Again, great questions coming in on both Facebook Live and on our Q&A. And I would encourage you to continue sending them in. Here's another good one. Once vaccinated, how long will immunity last? Will we need a yearly shot like the flu vaccine? Will the time it takes to get 80% vaccinated, how long will it take to hit herd immunity? We kind of dealt with that. But the first half of that question, it's a yearly shot. Is it not? What do we know at this point?
Unfortunately, we don't have a clear-cut answer for that just yet because this is still an ongoing and developing understanding. I mean, I know we've been struggling with staying at home for over 9 months now, but unfortunately, the science doesn't have an answer for how long this will last. But I hope, with all this information, if it does become a yearly booster, all of you out there watching, do go and line up just like you do for your flu shots.
We can also look at similar viruses. So SARS-CoV-2 is a coronavirus. There are 4 coronaviruses that cause the common cold. And like I tell my students, there are about 270 common cold viruses, and you get them you get about 4 a year, and you get the same ones that you had when you were 10, again at 20, and so on and so forth. They just keep recycling. We also can track something associated with SARS-CoV-2 called the molecular clock. We know how fast it's going to mutate. That is something that can be tracked and is being tracked. Combining those two data points, these data that we have the ability to predict that this coronavirus immunity could last 6-8 months, maybe longer, but they can't say for sure yet, just like Matt was saying. And so, unfortunately, like everything else with this pandemic, you get to peer behind the curtain. This is what science looks like. It's not like what you see on CSI. You are seeing it with the scientists. And I know that can be scary. So just remember that as this information is changing, what you are being told is not incorrect at the time, but science is evolving. And so that may be one of the things that changes moving forward.
Here you go again. It was a good follow-up question from the audience. You talk about evolving virus. Will this vaccine that's out now work against the new strain that is presenting itself? Started out in the UK. Now it's at various places in the United States. What do you think about this new strain and what we're doing from a vaccine standpoint?
It's expected to still confer the same immunity because this spike protein is highly conserved among strains of the coronaviruses that we've seen. So rather than targeting one specific strain, it's expected, though again, we don't have explicit data yet because this new strain is still very new and developing, but it is expected that the current vaccine should confer the same level of safety for the emerging strain.
And just to add to that, when we have an immune response to any kind of vaccine, what happens is we make more than one kind of antibody or more than one kind of fighting protein. So think of it like a war. When you are fighting, you have infantry and cavalry. If you're in the olden times, now you have infantry and drones, we have tanks. We come at things with a bunch of different ways. We also have diplomacy. The same thing happens with the immune response. There's this antibody that can bind to this portion of the spike protein, and then there's another antibody that'll bind to this one, and another that'll bind to this one and this one. And all of that happens with the vaccine. It's called polyclonal, poly for many clones. So if you're a Star Wars fan, it's not just Jango Fett, right? It's all of them, right? So all of the different kinds of clones that look differently. So what happens is, in that regard, there is a very high likelihood that one of the multitude of antibodies that are binding to that spike protein will also bind to B117, which is the new strain that is being seen.
Thank you. And by the way, Boba Fett is getting his own series.
Oh, yeah, you're right.
A lot of excitement for Star Wars fans, I can tell you. Here's one off of our chat. Is there anybody have any idea when there will be a vaccine for children under 12? And I've seen that reported widely that even under 16, maybe you shouldn't get the vaccine currently. And will the children's vaccine be an annual or a lifetime vaccine, do you think? Either. Go ahead, Jen.
There are currently clinical trials happening with both the Moderna and the Pfizer vaccine associated with children under the age of, for Moderna, it's under 18, and for Pfizer, it's under 16. They are looking at that, but what we do have to think about with kids is that while they are smaller, their body mass is smaller, their body weight is smaller, the dosage is what has to be adjusted for children. It isn't that the mRNA blueprint is not safe for children. It's the dose. So just like whenever you are getting amoxicillin or a Z-Pak for your ear infection, and you have a son or daughter that has amoxicillin or a Z-Pak for their ear infection, they have to take it in a smaller dose 3 times a day, where you get to take 1 pill. So the same thing has to happen with kids when we're dealing with dosing. The issue is the dosing, not the efficacy or safety of the vaccine. It has to do with how much should we give them based on their body weight. So you do it with Tylenol. So we need to make sure that we also do it with a vaccine.
Great, thank you very much for that. Trying to find some newer questions here. Are there any other vaccines close to being ready for approval in terms of the research and the preparation? Go ahead and address that one. We've got a good second question.
So as was mentioned earlier, there is the Oxford vaccine being developed, which is showing promising clinical results. And also currently in the UK, there's been a vaccine developed by AstraZeneca, which instead of giving an mRNA is more analogous to a traditional vaccine, using a spike protein added on to an inactive influenza vector. That one's actually been approved for use in the UK, and I would not be surprised if we see approval for it soon here in the States. So we got two in the pipeline, which, given how quickly this has been developed, is quite impressive.
All right, also from the chat from Facebook, can we talk a little bit about vaccines for women who may be breastfeeding and what the risks or the opportunities might be there? Matt, you were nodding your head.
Yeah, so the biggest issue with the breastfeeding is something that we've been kind of pointing out a bit here, is that we are seeing behind the curtain. We don't quite have an answer yet. Much like adjusting the doses for children under the age of 16, with breastfeeding women, we don't have enough data to conclusively say yes or no. So to err on the side of abundant caution, it is advised to wait until there is further information coming out about that. We want to make sure that we don't put anybody unnecessarily at risk, especially with small infants. And those are definitely people we want to make sure are not at risk at all.
Good. Here's one from the Q&A. It seems to be more of a general question, maybe related to vaccines, but I think we can answer it anyway. If someone has had and recovered from COVID-19, are they still able to pass the virus on to someone?
No. If you have recovered from COVID-19, you are not able to pass the virus on. What does happen in some cases is individuals will have a longer cleanup phase. And I like to equate this to, say you have a really fantastic 4th of July party and there are 20,000 people in your backyard. It is not going to be cleaned up in 2 days. So the same thing happens with a virus. Each individual cell in your body that gets infected with SARS-CoV-2 has the ability to produce anywhere between 8 and 10,000 viruses. And then your immune system has to clean up all of those cells that have died or are damaged and all of the viruses that were released from those cells. So it's like having a 4th of July party in your backyard with 20,000 people there. You're going to have some garbage to clean up. And so you are not contagious as long as you are not symptomatic. So if you haven't had a fever within 24 hours without medication and your symptoms are improving, you are unlikely to pass that on to someone else, but you may still test positive for the virus.
There's a similar kind of a philosophical question. I'm a teacher, but never was tested. When I get my turn to be vaccinated, should I get tested to make sure I'm not positive first, so I'm not overloading my body with the virus?
So with respect to that, is you don't need a negative test in hand to get the vaccine when your time does come up. If you are testing positive, it is advised to wait, especially for not only yourself, but the safety of those administering the vaccine. But you don't need to have a negative test in hand, especially because all this is doing is flooding your body with that blueprint of a protein. It's not going to increase your viral load at all. But it is advised if you are symptomatic or have tested positive to at least wait until you're not symptomatic anymore.
Thanks. Here's a question from the Q&A from someone who identified herself as a Cambria County resident And she's interested, is there a waiting list for a location I can pre-sign up for the vaccine? She says no one seems to know where they are being distributed.
So right now, there are two ways that the vaccine is being distributed in the state of Pennsylvania, as well as in Cambria County. If you are watching from another state, you'll have to check with your health department for that. Since we're only in 1A in Pennsylvania right now, what's happening is that the hospitals are getting delivery of that vaccine to themselves, and they are working to vaccinate their population, individuals who work there, individuals who are in direct contact with the public. Operation Warp Speed is working with nursing homes and through CVS and Walgreens, and they are vaccinating individuals who work in the nursing homes and individuals who are in the nursing homes to prevent that or to provide immunity to them through the vaccination. Moving into the next phase, which will be 1B, you will, depending upon where you fall in 1B, if you are over 75 or under 65 with some certain health conditions, you will go through CVS or Walgreens, and that information will be forthcoming from the state. If you are working as a teacher or another, what we refer to as essential worker, right now, those plans are going to be distributed through your place of employment. They will be in touch with you, and they are going to work both in conjunction with the local hospitals, as well as, depending upon ages of the employees, with Operation Warp Speed. As of yet, since we are not in that phase, those kinds of logistics have not been fully worked out yet. But I urge you to check that website that was posted in the chat and on Facebook Live for Pennsylvania. And that information is updated about every day, sometimes twice a day, depending upon where we're at. So you can check there for more information. But right now, as of right now, the answer to your question is no, there is no place for you to do that.
All right, and reporter Randy Griffith from the Tribune posted, just so we all know, federally qualified health centers are also getting vaccine now for first responders and independent healthcare providers. So thank you from the knowledgeable Randy Griffith, who covers healthcare from the Tribune-Democrat. Hopefully everybody's following him throughout this pandemic and staying on top of everything you need to know, in addition to what you're getting from these great forum panelists. Again, thank you to both Matt and Jill for their insight and their intellect and their background on the pandemic, and specifically vaccines. I remind you, you can post questions on Facebook Live. You can also post them in the Q&A function of the forum. And at the end of the event, we're going to have a survey that we're hoping everyone can stick around and fill out, so we get your feedback. This is a second in a series. And if I say a series, we don't know how many we're going to do, but we're going to keep doing them as long as we think there are important questions that need to be answered for the community and for the region. So hopefully you'll fill out that survey to help us continue to push these out and continue to make them worthwhile for folks who tune in. So thank you very much. Here's one. I think we've kind of dealt with this, but this seems a little more specific about studies on immunocompromised people and the vaccine. Have there been, I think somebody might have touched on that earlier, about research or clinical trials for folks immune compromised. We reiterate that.
Sure. Go ahead.
So individuals with autoimmune disorders are typically not included in the first round of clinical trials. They do have, if they have underlying conditions associated with it, but the clinical trials that occurred did not have that. They did not have those individuals in there, to my knowledge. I could be, Matt, are you elaborating?
I haven't seen any. The only thing I've seen regarding people with autoimmune disorders, things like that, have been to just check with your physician. Although currently there's no contraindications,
right,
there's not a guarantee that there could not be an issue.
Right. So the recommendation at present is to make sure that you check with your primary care physician or your specialist to make sure that they can talk through the risks with you. And each individual autoimmune disorder does have some differences and nuances to it. So you can talk with your doctor. But what is known is that most autoimmune disorders are being considered safe for those, simply because it is just that blueprint that Matt was outlining. It's not a pathogen, so there's less of a chance for adverse side effects because of that.
Speaking of side effects, another question from the Q&A. Someone asked, what are some of the side effects that we can expect from the vaccination? Is expect the right word? I mean, are we really going to see widespread side effects?
So
It's possible.
Yeah, it is. Go ahead, Matt. Go ahead.
It's definitely possible that you will see something arising from the immune response. The most that we've heard so far is it's like when you get a tetanus shot and your arm is sore for a few days. I personally, last time I had a tetanus shot, my arm hurt for a week. But the main side effects that you should expect would include a little injection site pain because it is an intramuscular shot, similar to a flu vaccine where it's not just going into a vein or an artery, it's going right into your muscle, and those tend to lead to some soreness. A lot of people have been experiencing tiredness afterwards, and possibly those swollen lymph nodes close to the injection site in your armpit area, simply because your body is mounting an immune response, albeit to a fairly harmless vector. I don't say innocuous, but it's a fairly harmless attack, but your body still has, to use Jill's analogy there, is going full on with the war. It's bringing the infantry, it's bringing the cavalry, the tanks, the drones. Your body goes in with this thing full tilt, even though it's just jousting at a windmill at that point.
And that discomfort that follows a shot, that's an indicator, right, that the shot is actually starting to take effect and move into your body rather than just, physical pain from getting a shot.
Exactly.
Great. Here's an advanced question we had from a local healthcare worker. For someone who recently got out of quarantine, should I wait to get my vaccination?
Since you are in the medical profession, you can get the vaccine in accordance with the tier 1 rollout. So, but the guidance from the CDC suggests that you are not precluded from getting the vaccine. If you become symptomatic, then it is advised that you wait until your symptoms resolve to get that vaccine. So you'll need to contact your local hospital or your employer to arrange that vaccination, but the healthcare rollout is currently underway. Simply because you were exposed does not preclude you from getting the vaccine. In fact, it is suggested that if you are not symptomatic, you don't need to wait to receive it.
Great. Here's a question from our Q&A. And again, some of these are nuanced, slightly different from earlier questions, but I think they are very important nonetheless. If you would contract COVID after you've been vaccinated, and I guess the first question is that possible? But say in the 10 to 14 days post-booster, would or could you contract COVID again? And will it have any effect on the vaccine protecting you in the future?
So with that, the big question is, can you be infected after you've been inoculated? And the short answer is unfortunately yes, but your body is already mounting a better immune response than somebody who had not already received the vaccine. In fact, a friend of mine out in Roughdale, his wife was vaccinated and tested positive 3 days later, unfortunately. So they've been having a bit of a war between the body developing that immune response from the mRNA, developing the spike protein, and the natural immune response being developed. But at the end of the day, it is still possible. So it is advised, even if you've been vaccinated, follow that 14-day, stay social distance, stay away from people. I know it's difficult, especially when you've been vaccinated, thinking everything is going to be safe again. It is possible then to test positive, get the virus, but following that 14 days, the likelihood of getting it again is significantly reduced. We're looking at 90 to 95% immunity from the vaccine combined with that then developed natural immunity. It is highly unlikely the person could develop the virus again. But as Joe pointed out, it is possible you could just become an asymptomatic carrier. As soon as we know something, we'll obviously see an update. But for right now, it's better to err on the side of caution.
Okay, back to the Q&A for a good question. Philadelphia is now offering an alert system to let people know when it's their turn to be vaccinated. Could we do anything to have something similar implemented in Cambria-Somerset region for folks living here?
Yes. The issue is that with that, that's associated with part of the COVID tracking app that the health department is offering. If you are interested in signing up for that, there is an option where you can go about and get that kind of information about when you'll be alerted. There are also going to be lots of pushes with the Tribune-Democrat. They'll be posting those types of things. You're going to find it on various different kinds of websites. They're going to have it on the television. So there are plenty of ways for you to find out when the phases are rolling out. The best source of information right now is that website that the state says we are now currently in phase 1A, moving to phase 1B. So that's the first place that I would go to look for that kind of information. And then moving forward, once you are in that group, you can go through that app or find it on the television or look in the news sources that you commonly see.
It looks like we've posted a link to that app on our chat, so that's very helpful information. And thank you for the shout out to the Tribune. We're very pleased to be part of this along with UPJ and in this together, Johnstown. Hopefully it's something the audience members are finding very informative. Here's another advanced question we had ready. Someone asked, I'll be getting my second shingles shot this month. How long should I wait then to get my COVID vaccine? Is there a conflict there?
So it's just recommended that you wait 14 days before you get another vaccine. So if you're getting your shingles shot, then you want to wait 2 weeks or 14 days till you get another vaccine. It's really just precautionary until studies can be done when we're looking at combining vaccines like those that have been done for the childhood vaccines that children get in their infancy through their toddler years. It's best to be abundantly cautious and just wait 2 weeks until you get that next vaccination. You're muted, Chip.
I think you're muted there, Chip.
You're muted.
Again, thank you very much. I think we're on mute. We get a lot of great questions. Keep them coming, both on the Q&A on the chat. We had one in advance about rheumatoid arthritis. I think we've kind of answered autoimmune situations, so maybe we've already taken care of that. Anything you want to add to that? Rheumatoid arthritis, anything specific to that?
Just in general, don't be afraid to contact your physician for the medical advice they can provide. Right now, there's no advisory against autoimmune disorders, but it can't help if you check just with your physician or your primary care provider or a specialist prior to getting the vaccine, just to be abundantly cautious, to sort of echo the sentiment of this entire talk. Just err on the side of abundant caution.
Just for folks listening in, I think we're going to wrap up about 8 o'clock. It's about 8 minutes till 8. So get those last couple questions in. We're getting down to the end. Here's one from the Q&A. Are there any people who should not get the vaccine? Either of you.
I think that's something that is individuals should discuss with if they are concerned about underlying conditions or their underlying medical issues, they need to consult with their physician. As it stands right now, the vaccine is safe and effective for individuals over the age of 18 if they are getting the Moderna vaccine, and over the age of 16 if they are getting the Pfizer vaccine, even for those with underlying conditions. However, if you are concerned in any way about that, you should check with your physician.
Okay, here's another one we had ready in advance. I've been vaccinated 2 weeks ago with Moderna vaccine. The county now says they have no vaccines left. If they don't get in a supply in 2 weeks, or it does go to vaccinate new people, can I get the Pfizer vaccine for my second dose, or what should I do?
You can't switch between vaccinations. So that's a good question, and I'm certain that it's going to come up. If you get the Moderna vaccine, you must follow up with the Moderna vaccine. If you get the Pfizer vaccine, you must follow up with the Pfizer vaccine. It's okay if you can't get it immediately at 21 days for the Pfizer vaccine or immediately at 28 days for the Moderna vaccine. If it's delayed slightly, it will not decrease the immune response that occurs. It will simply not provide you the full amount of protection until 2 weeks after that second dose. But they are not to be given one Pfizer, one Moderna, or vice versa. You must stay with the vaccination that you get.
And just to add on to that, as we've said, the second dose is merely acting as a booster, even though they are still giving you both that mRNA blueprint. Don't cross them. And there is currently no maximum window for the second one. The 28 days was what was tested in the clinical trials. Currently, if you do have to wait, if there is a delay, just know the second dose is a booster. It's upping you from that 50% immunity to about greater than 90%. So if you have to wait, it is okay.
Let's get in one last question here from our Q&A. If you are pregnant or planning to become pregnant, is it safe to get the vaccine?
So with that, I urge you to check with your gynecological provider. In most cases, pregnant women have had no issue associated with different kinds of vaccinations. With this one in particular, we have seen, based on natural active infections, individuals who are pregnant who then become infected with SARS-CoV-2. It has not had any adverse effects to the children that were born from those pregnant women, but we haven't had specific studies associated with that. So I think that is an excellent question to bring up with your gynecological provider or with your obstetrician. But with the data that is currently known, we do know that pregnant women were infected and nothing happened to the fetus or to the baby. And so what we can extrapolate from that, but no specific studies have been done on pregnant women.
Okay, thanks so much to Matt and to Jill, our great panelists tonight. Looking ahead, our next session will be January the 26th at 7 p.m. And I believe Jill will be joined by Paul Ricci, who will be talking about COVID by the numbers. So that should be a pretty interesting session. And again, a reminder to complete that survey that comes up after the session ends. There it is, just popped up. And with that, we're going to turn things back over to Eric to bring us home.
Thank you very much, Chip. Thank you, Dr. Henning, Dr. Tracey. This was very informative. Yes, please fill out the poll if you can. We're going to have more questions. This is going to be this has been videotaped, so it'll be on the UPJ Facebook page as well as the In This Together Cambria Facebook page. Tribune-Democrat will host this video as well. There are a lot of similar questions coming in throughout the evening. Well, on behalf of Pitt-Johnstown, the Tribune-Democrat, In This Together Cambria, I'd like to thank everyone. Please stay in touch with us via Facebook and social media for the next event. Thank you, everybody. Good night.